Welcome to Kathryn Raaker's World. Innovation, culture, adventure, fashion and health, artists, destinations, traditions. This is Kathryn Raaker's World.
Hi, this is Kathryn Raaker of Kathryn Raaker's World. You know, May is Mental Health Awareness Month, a time to increase awareness and support for those impacted by mental health conditions. It's also important to note that some people living with a mental health condition may also experience TD, a chronic condition characterized by uncontrollable body movements that can occur in one or more areas of the body. TD is associated with taking certain mental health medicines, like antipsychotics, to treat conditions like depression, bipolar disorder, schizophrenic disorder, or anxiety disorder. Joining us today to bring more awareness to TD and explain the symptoms impact is Dr. Rakesh Jain, and he's a clinical professor of the Department of Psychiatry in Texas Tech University School of Medicine in Austin, Texas. Thank you for joining us today. And you know, it's so important. So many people have mental illness and they may not even know it. Am I right, Doc?
Yes, absolutely. In fact, you know, like any other human being in my own family, there are lovely people, but some of them do have mental health challenges. It is part of the human affliction.
Can you explain to my audience the issues surrounding mental health when it comes to medication?
I'd be happy to. So as I said before, many of us, while we have very successful lives, can be afflicted with a mental health challenge. And many of us will seek psychotherapy and sometimes even need medications. And you said it very well at the beginning that TD can be associated with certain medications that we take for a variety of psychiatric conditions when we treat them with antipsychotics. And Kathryn, the way TD presents itself, the way it arises and arrives in human life is often a big surprise. It's when your muscles, the very muscles that you believe you have full control over, on your face, maybe your eyebrows, maybe your eyelids, maybe your muscles that you make our facial expressions with, maybe our tongue, they betray us. They start moving around on their own, and for no good reason, they might be jumpy or writhy, as I'm showing you here with my neck and my shoulders. These are very impairing. They can make talking very difficult, typing very difficult, cooking very challenging. And of course, you can imagine, can't you, the psychological distress that comes with, and the social, the difficulty in interacting with people challenges that can go along with it.
Can you tell us more about TD and what to be looking for maybe in
Yes.
ourselves or our relatives or somebody like that? I mean, seriously?
I know. We love our family members so much and we want the best for them. And if a condition like this arises, we too want these conditions to be improved. So let me just thank Neurocrine Biosciences for sponsoring this very important conversation between us. And the way to identify TD is to be observant, both observant of yourself, if you're the one taking that kind of medication, but also observant of a family member. And what are we observing them for and ourselves for? Well, it really is noticing, are there muscles? Remember, tongue is a muscle. My eyebrows are moved by a muscle. My eyelids are controlled by a muscle. My face, the expressions I have on my face are controlled by a muscle. If we're noticing that those muscles kind of have on their own movements that I'm not wanting, but they're doing it on their own, that very often is the very first symptom of tardive dyskinesia. And the truth of the matter is, Kathryn, it can affect any part of your life, including your hands and your feet.
Can you tell us how, and is it a certain age, or is it just come on, doctor, or what? Can you kind of give us an idea
Yeah,
of that? That's important.
I'll be happy to.
Go.
Yes, Catherine, I'll be happy to. So it can affect any age, but being older is no friend. It's more common in women than it is in men. It can be more common in people who have a mood difficulty. So there's a lot of risk factors, but the single biggest thing I would encourage patients and their family members to observe for and to be aware of, it's not their fault. It's not their fault, but it is their obligation, if they notice something, is to say something to the healthcare provider team. And just in case your listeners are and your viewers are more interested in knowing what TD looks like and what are the patient stories, there's a great website called Talk About TD. talkabouttd.com that really offers a wonderful perspective of what is TD, what are the treatment opportunities that exist for them, how to have this conversation with your healthcare provider, and how to make sure that this condition doesn't live in the shadows anymore, that we drop the stigma and these patients come out and really acknowledge there is a difficulty and let's seek treatment for it.
Is there a cure for it at all?
There are treatments for it, absolutely. And those treatments are discussed really well in that talkabouttd.com website. That is the silver lining here. I think that's one of the main reasons why I wanted to come be with you and your viewers today, Kathryn, is because I want to remind people, while this is no fault of their own if they develop TD, however, the thing to remember that's very important is there are treatments for it. That's the silver lining here.
What is it like for the patient when they first figure out or find out that they have TD? And, is the medication, can you drive on the medication? Is there certain things that you should be looking at as far as that's concerned?
Yes, so that would be a conversation the healthcare provider and the patient will be having about the specifics of the medication, what they can do. But here's the good news. Most patients, when they're on treatment, actually live really fulfilling lives. And the whole goal of treatment, obviously, is to make sure that the balance between side effects and efficacy is ideal. And that's the conversation healthcare providers have with their patients hundreds of times a day.
Do you see, since the pandemic, more of this than not?
I do. I really, truly do. Mental health has been challenged. And of course, one of the consequences of that could be increasing rates of it. But again, let's be very positive about it. While the rates may be rising, our recognition and the fact that we're having this conversation is clearly a signal that we are moving in the right direction. And I thank you so much for inviting me on your show and really talking about this important issue.
Well, what are the key takeaways that you want my audience to remember about TD and mental health overall, and give your website again, because that's really important to people to educate themselves on what this type of mental illness is.
Kathryn, you said it. So talkabouttd.com. I invite you and all of your viewers to come visit it. Thank you so much.
And thank you so much for the mission that you're doing in educating people to this disease. Thank you so much. And we'll be right back after these messages on Kathryn Raaker's World. Thank you, Doctor. Hi, this is Kathryn Raaker of Kathryn Raaker's World. More than 37 million people with diabetes today in our country. And for many of them, nerve damage caused by diabetes, a condition called diabetic peripheral neuropathy or diabetic nerve pain, is a common complication that most often affects the lower extremities and normally presents itself as a tingling, numbness, burning, shooting, or stabbing sensations. These symptoms can cause debilitating pain. There are far too many patients who may not recognize diabetic nerve pain symptoms or living with unresolved pain. Veritas Pharma has partnered with the American Chronic Pain Association and members of the medical and patient community to launch Speak for Your Feet contest to bring awareness to diabetic nerve pain and emphasizing the importance of identifying symptoms and talking to your healthcare provider earlier in your treatment journey. To support the important discussion today, we have Kathy Sapp, CEO of the American Chronic Pain Association, a philanthropic organization, and Dr. David Armstrong, podiatric surgeon and researcher with Keck School of Medicine of the University of Southern California. I hope I didn't screw up that part, but that's
oh gosh, no, that was pretty darn good. Certainly better than I could do.
Thank you. So anyhow, I want to ask you, Dr. Armstrong, to start off. Welcome to our show, both of you.
Hey, it's a complete pleasure. Thanks for letting me play hooky from what I'm sure is a crazy clinic going to be starting soon.
Right. So, doctor, can you tell us about diabetic nerve pain and the symptoms?
Yeah, happy to do. So as you had already mentioned, there's like about 37 million folks with diabetes around the United States. About half of them will develop peripheral neuropathy, which, as you mentioned, which are problems with the nerves. And it starts in the feet and it kind of works its way up. But that's what's really, really important to know. And a really good proportion of those, several million each year now, have painful diabetic neuropathy, and that pain can be all over the map. It's just often different and unique for that individual patient. For some, it can feel like it hurts when the bed sheets are touching it, really sensitive. It can feel numb. For others, it can feel just terrible burning. It could be sharp and shooting pains or just electrical signals. All these sorts of things can start almost like a downed power line arcing and creating these sorts of things. But that difficulty in describing things often leads to delays in diagnosis and treatment. And so there can be this cascade, Kathryn, of developing, loss of sleep, insomnia, and depression, and your poor sugar control. And it can really, really spiral, but it doesn't have to be that way.
Well, can you tell us what the major challenges in treating those with this condition, doctor?
Sure. Well, first and foremost, one of the major challenges is just knowledge that these problems exist. And so, because it happens so slowly, it just creeps up on people. And suddenly they're living with this, but they haven't really described it well to their doctor or to the nurse. And that's why we're really launching this program called Speak for Your Feet. We say, knock your socks off when you get in to see your foot doctor and or your general doctor, and speak for your feet. And that's what Kathy's organization has been doing.
Kathy, welcome to our show as well. Tell us about the new educational campaign to support the millions of Americans suffering with diabetic nerve pain and how we're doing it. Can you tell me that?
Yes, I can. Thank you, Kathryn. So as Dr. Armstrong alluded to, one of the biggest problems is getting people to see their physician. They need to be aware that they may have a problem with their health, and a lot of times they ignore it. And what we try to do is encourage people to see their doctor, have that dialogue with them, bring in the tools that they need to have that shared decision-making approach. And so what we've done to raise awareness is that we've launched a contest. And it's very unique, and it's so that patients can share their symptoms of their condition. And what we're asking is that for everyone to create a short memory aid or a mnemonic that describes their pain. And they can enter online at nervepainandme.com/contest.
Well, the other thing is, Kathy, in addition to the launch of Speak for Your Feet, what is being done to really improve the treatment and lives of those with diabetic nerve pain? And don't you call that neuropathy usually?
Yes, you do. And I think that I can speak to what the American Chronic Pain Association is doing, but from a medical standpoint, from a medical advice, I'll let Dr. Armstrong take that piece. But The American Chronic Pain Association just launched a diabetic nerve pain toolkit, and this includes resources to help patients start a conversation with their healthcare provider, like we talked about earlier.
You know, sometimes, Doctor and Kathy, people don't want to admit they have the actual pain, and they don't realize that this can be taken care of, right?
Yes.
By talking to your doctor. And if you don't like your doctor, fire your doctor, get somebody else, right?
That's it. That's right. And you're hitting on it, Kathryn, is that that's why we're trying to do this. That's what Speak for Your Feet is all about. It's this dialogue between the patient and her or his doctor. So the doctor isn't doing something, to them, it's doing something with them. And that's the problem that we're trying to solve. The great news now is that there are therapies that can help pain, manage them, non-drug therapies, and then also pharmacologic therapies and combinations of these sorts of things, and even interventional sorts of therapies. So, and the sooner you get out in front of this, the sooner someone can get on to moving through the world and enjoying a high quality life.
So, Doctor, what are some of the key takeaways that you want my audience to learn from today's appearance with us?
Yeah, so number one, this problem is common, it's complicated, it's costly. It's affecting millions of people every year. These symptoms can be all over the place: burning, numbness, tingling, sharp shooting pain. But there are therapies. First thing is to get in to see your foot doctor, get in to see your general doctor, knock your socks off, speak for your feet, and ultimately it can help keep a few more legs on a few more bodies and keep people moving through the world.
I love to speak for your feet because that's the truth. It's really your feet that you have to think about, right? So,
especially when they're barking.
Yeah, right. Kathy, I want you to give that website one more time slowly so Kathryn can write it down. How about that?
Okay,
Right ahead.
okay. That sounds great. It's nervepainandme.com.
Okay,
nervepainandme.com/contest.
.contest. nervepainandme.com contest. And I'm going to have all my listeners, and I'm going to put it up there for you, so don't worry. Everybody will know. How long does the contest last?
It ends November the 1st.
November 1st. And so today I could tell everybody that I know, including my audience, get out there and get on this contest. What are the prizes?
The prizes are, the first prize is $1,000, a $1,000 gift card, or 2 tickets to the American Chronic Pain Association Pain Freedom Conference, which will be held in Colorado. And then we also have 3 runners up for $100 gift cards with Visa.
Right. I can't thank you enough for both of you for your mission and what you're doing to really speak for your feet and get better, right?
Thank you for the opportunity.
There we are.
Would you give both your websites so our audience can go and get more information?
Yes, it's www.theacpa.org.
acca.org. And Doctor, yours?
Oh, you can just go to diabeticfootonline.com. How does that sound? Just like it sounds.
Online.com. I'd love to have you back on the show anytime.
Well, listen, and you guys you're welcome out at our place.
Thank you very much. I really appreciate what you're doing and your mission. Hi, this is Kathryn Raaker of Kathryn Raaker's World. Joining us now to discuss the controversy around explicit books available in students is Sheri, who serves as a founder and president of the United States Parents Involved in Education, USPIE for short. Sheri also serves as an executive producer for the new film documentary, Truth and Lies in American Education. The film is available for viewing on the film's website, www.truthandlies.com. and liesfilm.com. I want to welcome her to our show today. Welcome to our show, Sheri. I really am excited about it. And let me ask you this question to start. There was a case in the Epic Times. A Colorado mother was cut off at the local school board meeting while reading about a graphic passage from a book that is available at the school district. The school board described the mother was out of control and determined she stopped reading. The mother protested and said, "This is what you allow in our schools. This is what you allow for our kids to have access to. This is pornography, and this is grooming for pedophilia. This is grooming for pedophilia." So tell me, Sheri, was the school board right in cutting off the mother from reading a sexually explicit passage, or should she have been permitted to make her point?
Well, obviously, if children are able to access these materials, a parent ought to be able to read it aloud at a school board meeting. And if it's that explicit that it can't be read aloud at the school board meeting, then it does not belong in the public schools for children's perusal. So obviously, they should have let her continue, or she made her point by having them shut her down. And it should have been resolved based on that.
In the face of some of schools trying to reach critical race theory and other controversial topics, what do you think about the availability of such reading material for children?
Well, I can tell you with recent events, especially when the American Libraries Association recently chose as their next president a self-proclaimed Marxist lesbian who took to Twitter and said that she was going to use collectivism to address race, white supremacy, imperialism through her new role at the Library Association. So these are the folks that are leading the libraries, and the school libraries are affiliated with the American Library Association. And in fact, the president of the American Federation of Teachers, Randy Weingarten, endorsed this woman for this presidential role. And she has concurred with her in the fact that she will use her role to advance their very liberal agenda, and even in the government schools, as we're already seeing happening. But this is a travesty to see that, parents are being called domestic terrorists when they speak at a school board meeting, and they're cut off from being able to speak because information is too explicit. And yet these other organizations are saying, that we're the ones that need to be censored, that we are censoring, in essence, if we say that we should ban these books. And the truth of the matter is, it is pornography, and it has no place inside government schools.
This has gone way, way overboard, don't you think?
Oh, absolutely. And we believe the United States Parents Involved in Education, the organization which I direct, we believe this is child abuse. I mean, there are laws in our country that prohibit pornography for children. And so it's illegal, it's child abuse, and it has to stop. And we talk about the sexualization of children in our documentary that you mentioned at the opening. So it's not just the fact that they're teaching sexually explicit things to very young children, some of the things like you mentioned, but even the heavy transgender influence in schools that's being done behind parents' backs. So this is one of the main topics. We also talk about critical race theory. We talk about the anti-American propaganda that's being taught in government schools, and even false history. There are a lot of problems. It's a serious liberal indoctrination that's happening in America's classrooms. And that's why we ask everybody to view our films so they can get informed, again, at truthandliesfilm.us. And once they're informed, they can pass it along to other people, because we need to grow a grassroots army to stop the liberal indoctrination of children, to protect children, and to protect our country's freedom.
Are you doing it in schools as well? Not schools, but churches and other organizations that will allow you to do it?
Well, we are encouraging those who view the film, because you can go to the website and you can download the film and you can take it to your church and have a church viewing or a neighborhood viewing. It's a very good idea to watch it with other people and then talk about what you're going to do to get involved. And what we encourage at the end of the film is to go to our website at USPIE, that's USPI.org, and there they can sign up to join the movement. We have 20 state chapters and we're growing, and we can get them connected with people in their state, or we can help them to start a chapter in their state if there isn't already one.
You know, we've seen examples of people harming and even burning books before. What are your thoughts on the availability of such books? Is it okay to offer them elsewhere outside of schools?
Well, absolutely. So the idea that we're being attacked for banning books, again, is problematic. It's actually contradictory, because it is the parents and individuals that are speaking out. Those are the ones that are being censored. And so not allowing pornography for children is the right thing to do. It's not banning anything. It's actually upholding the law. So it is illegal to show pornography to children. It should not be happening. So then, as far as the other issues that are being taught, the critical race theory, it's Marxist in its roots, parents are outraged. And that's sort of the silver lining, if you will, of the COVID pandemic, was that parents were able to see what their children were actually learning. And so it's time that we return to a classical form of education, stick to the basics, the 3 R's and not 4 R's that includes racism. And we need to begin to educate children again and teach them how to think instead of what to think.
And we're running out of time, but if it's not through literature, what is the best way to teach children about such subjects matter, if it should be taught at all?
Well, some of it is just downright untruthful. So obviously we don't want to teach children things that aren't true. And that's why we named our film Truth and Lies in American Education, because we're revealing the truth about the lies that are happening in government schools. So by and large, I would say most of these topics need to be just thrown in the trash and not taught at all. But if a parent wants to teach their child about sexual orientation or gender identity, that's their prerogative. And it should have no place or no bearing in a taxpayer-funded government school.
Right. I want to thank you for joining me today on Kathryn Raaker's World. And where can we go to get more information about the film, please?
So again, if you'll go to truthandliesfilm.us, you can view the film there. You can send other people there to view the trailer and get it out as far and wide as possible. Again, our goal is to grow a grassroots army across the country, because that's what it's going to take to protect children and to protect our country's freedom.
We really appreciate your mission. And I want to thank you for joining me on Kathryn Raaker's World. Don't forget to go to our website at KathrynRaakersWorld.com.